You are such a busy doctor, then how will you screen such patients in a busy practice?
You are not treating diabetes in pancreas. You're treating diabetes in the entire person. Why I'm saying this? We are going to come out with a scale which will be mandatory for every physician to apply in the diabetic clinic. You will look at the patient whether he is coming out with some areas, some apprehensions, some views that he's finding it difficult to monitor sugar every week, type 1 diabetes every day, 4 times a day, he's finding it so overwhelming because, so that is built in. The second thing, there's a checklist. Checklist is how often you have taken your walks in the morning, how often you have taken the type of diet prescribed to you, how often do you deviate, do you have a drug holiday or you take drug every day. All these things are subtle questions which will be catching up diabetes distress, and we are coming out with a set of questions and set of examinations which Dr. Sunil, once it is ready, I like you to take it to the public.
Hello friends, today in our DEWANI podcast, myself Dr. SUNIL DEWANI, and I am welcoming our most senior consultant physician and diabetologist Dr. A.K. Das sir is with us. Today we discuss few questions about the diabetic distress. So sir, welcome to our DEWANI podcast. My question is, what is the difference between the diabetic distress and clinical depression in diabetic patients?
I think it's a very important question. Now, diabetic depression in a diabetes is a very generic term, is a general term, which is a mood disorder because of anything, feeling depressed, not feeling all right, feeling under the weather, that is more general. But diabetes distress, in contradistinction, applies to a person's difficulty, his psychological upsetness while taking care of his own diabetes. Am I clear,
Yes.
Dr. Sunil?
Yes.
What I'm saying is the diabetic distress is the particular person's psychological aberrations, difficulties, while taking care of the disease, like nutrition, taking drugs, keeping to the schedule, follow up, monitoring, coming for checkup, coming for screening. Whereas depression in diabetes is more generic, it is different, it is mood disorder in general in diabetes.
Thank you, sir. So my next question is, how common is diabetic distress is common in type 2 diabetic patients?
I'm very happy you asked this question because diabetic distress, according to latest literature from IDF, International Diabetes Federation, is anywhere between 50% to 82% in type 2 diabetes. I'll tell you why. Now, it's a very subtle disorder. People do not come out with their internal feeling while controlling their diabetes. They keep it to themselves. They consider by saying that they're having difficulties in rising to occasion of managing their own diabetes because of psychological problems, because of coping problems, because of finding difficulties, because of feeling under the weather or feeling that they cannot execute those difficulties, is they think it's become a stigma. I'll give an example. I have diagnosed diabetes in a young, to type 2 diabetes now come to the young people. Say at the age of 18, he has been diagnosed type 2 diabetes, and I'm seeing him at the age of 25, 26. He will not come out with the fear that he has that diabetes can produce eye complications, kidney complications, heart complications. He will keep to himself. That is diabetes distress. He will not come out with the idea that taking the tablet every day, 4 to 5 tablets every day, is a difficult thing. Similarly, for type 1 diabetes, taking insulin every day is necessary. For life, insulin is must every day. That is called insulin overwhelmicus.
Yes.
Or oral hypoglycemic overwhelmicus. They will not come out with that, but they are distressed.
Yes.
So the prevalence in the general population, in the general areas, it's about 50% to 82% in type 2 diabetes. The younger the person, more the distress. In type 1 diabetes, it is estimated to be about 40%.
Okay, sir. That's good. So, sir, my next question is, sir, you are such a busy doctor, then how will you screen such patients in a busy practice?
I strongly believe, Dr. Sunil DEWANI, I strongly believe when a patient enters to your chamber, it's your very integral and very religious duty to look at his face, look at his eyes, look at the person as a whole. You are not treating diabetes in pancreas. You're treating diabetes in the entire person. Why I'm saying this? we are going to come out with a scale which will be mandatory for every physician to apply in the diabetic clinic. Now, that consists of screening tools like, you know, it is said that the treatment for diabetes begins much before you prescribe the tablet.
Yes.
And that is where you start the conversation. And that is called a conversation based on your idea that the diabetes affects all the viscera, is a metabolic cum vascular, metabolic disease plus vascular disease. When with this idea, you approach the patient, you will look at the patient, whether he is coming out with some areas, some apprehensions, some views that he's finding it difficult to monitor sugar every week, type 1 diabetes every day, 4 times a day, he's finding it so overwhelmed because so that is built in. The second thing, that is checklist. Checklist is how often you have taken your walks in the morning, how often you have taken the type of diet prescribed to you, how often do you deviate, do you have a drug holiday or you take drug every day, meaning thereby in diabetes there's no drug holiday. We can give drug holiday in tuberculosis, drug holiday in many other medicine, but diabetes, not if you give drug holiday for type 1 diabetes, they'll become ketotic. So that is the reason why you have to see. So there are some checklist of drugs, daily activities, how is their sleep, how they feel to work, how they feel to go for a walk, how sincere they are in their working, are you finding an obstacle in the workplace? All these things are subtle questions which will be catching up diabetes distress. And we are coming out with a set of questions and set of examinations, which Dr. Sunil, once it is ready, I like you to take it to the public.
Thank you, sir. Thank you for your kind words and kind explanation about the diabetic
Thank
stress. So, take home message is just don't write the medicine or just
Exactly.
don't treat the patient. Just treat the disease and feel everything about the patient and how it's feeling, how it's
Exactly,
going on.
exactly. It's a disease which is larger than only pancreatic aberrations. It's a disease affecting from hair to the nail, and and the disease which is a part of the life.
Yes.
Once diabetic or always diabetic. We talk about remission, talking about cure. Those things are very utopian dream. So when a chronic disease like diabetes, a silent disease which can produce lot of harm, is you are in front of you, you have to have that inner eye. You must have that inner feeling. You must identify yourself with the patient's feeling, how he is feeling. I mean, how he's feeling. Just imagine every day you take drugs. You know how much an average Indian diabetic spends for his drugs? They spend in the middle class society 177 rupees every day average. A poor person spends at least 25 rupees. Where will they get from? Their total income is between 400, 500. So these are the things we have to inquire and give appropriate drugs or give him. These are the doctor, you have come to me today, I'm giving prescription, collect the drugs from the government, same drugs available. So this needs a type of mental makeup to help the patient, to allay his anxiety, allay his financial problem, to take care of his daily activities, things like that.
Thank you, sir. Thank you so
Thank
much
you,
for your
Sunil
Thank
Wadhwani.
you.
I'm very happy to be
Thank
here.